Good morning, everyone. This is the June 17th, is that right? Meeting of the Incarceration, June 14th.
14th.
Meeting of the Incarceration Prevention and Reduction Task Force, the Law and Justice Council for Whatcom County. I'm Stephen Gockley, and along with Jack Hovenier, the co-chairs. We'll start the agenda with the land acknowledgement statement. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. So the meeting will come to order. We're gathering a quorum, but we don't have any decision items at this point. Jack, do you have a question to raise for the group?
No, that I do. I was just testing my hand, first of all. Anyway, thanks everyone for being here. We appreciate that. So I do have a question for the group. When we set our calendar for the year, sometimes in years past, we had avoided August because August is historically a time in Whatcom County that people like to not be in meetings. To be honest, it's arguably the best month of the year. This year, August 16th is Fair Week for those of you that follow things like that. And I think that when we set our calendar, we didn't know if we'd still be on, well, I think we will be on Zoom, but my point is, I don't think we knew that likely in a few more weeks, we will see a lot more open events based on what the governor is saying. And I mean, I'm sure all of you have noticed the same things I'm noticing, that you're vaccinated, you don't wear masks many places now, and everything seems to be changing quickly. So the question is, and I'm not sure we'll have a quorum. Historically, August is a tough month for a quorum. But it's a rough question to ask, will we have a quorum? We don't know. So I think a better question is, do we want to have a meeting in August, or do we want to not have that meeting in August? We've switched from a bi-monthly to a monthly calendar. You can probably tell transparently, I'm in favor of not having an August meeting, in part because I plan not to be there. But I thought if people want to have it and there will be a quorum, there's no reason not to, but it seemed an appropriate time to ask. So I guess we would just kind of poll this. I don't have everybody's cameras, and I don't know if everybody knows how to, everybody knows how to raise their hands on Zoom. I assume by now most people do. There's a raised hand function at the bottom of your bar. So I guess the question I would pose is, would you support not having a meeting in August? And if so, raise your hand. And if not, then you want to have the meeting. I see you, Mayor Cordes. All right. So we've got approximately, for the record, more than 2/3 of the group, I would say. Would that seem accurate, Jill? Although Mayor Fleetwood's hands going up and down. I think he's playing. I think he was up.
I thought we were done counting. That's all.
Okay, your hand's up. Okay, got it, Seth. Got it. Perfect. Yes. Okay, thank you. I've kind of figured that. Okay, so I've got at least 13 out of the 16 hands raised. So, Stephen, my perspective of that is it would be a consensus, at least for this year, not to have an August meeting. Would you concur with that?
I would.
Does anyone in this group object to that? Particularly you, Barry. I mean, I see your hands up for the cancellation, but you know, we serve at the behest of the county council. So would that be all right with you?
I think that's a great idea, Jack. We'll be on our August break as well. So
okay.
I appreciate your sensitivity on that and bringing this up.
Well, as somebody said, I think it was Tank, about the weather, you have to make, what did they say? Make hay while the sun is shining. In Whatcom County, enjoy your August because October's coming. All right. Okay. Thank you so much, everyone. We have a decision. So the decision is that the August meeting will be canceled. And with that, I'm going to turn it over to Stephen, who has another topic for us.
Okay, thanks, Jack. And Jill, I think for clarity's sake to the whole membership, would you put out a specific email notice of the cancellation of the August meeting, please?
Yes.
Thank you. All right. Next topic on the agenda has to do with the mural project for the Crisis Stabilization Center. You've heard mention of this before, but Bellingham City Council member Holly Huffman is here to tell us a little bit more about it and make a specific plea. Holly.
Thank you, Stephen. Thanks for having me here. I'll try to make it brief. I do have some visuals to keep it a little more interesting. If I can screen share, potentially.
Give me a minute, Holly, and I will get you the permissions to do that. 1 second.
Okay, great. So I was listening in on a behavioral health subcommittee meeting a while back, and I heard Ann Deacon say, hey, we'd like to put murals up at the Crisis Stabilization Center. Know any artists? And I thought I could help with that. So I know some artists, or at least I know people who know artists. So let's see here, screen sharing. There we go. So I contacted Anne and asked if I could help with this. And then I contacted the executive director of Makeshift Art Space, which is an organization I've been involved with for quite a long time, currently on the board. And it was a match made in heaven. The executive director, Jessica Murphy, was really, really excited about this. And her gallery director, Emily, was as well. So they got to work on a proposal. They met with Crisis Stabilization Center staff and checked it out. And we are now in this project to the fundraising phase. So I'm coming here to this group because I know that this facility was a really, really important project to a lot of people in this group. And so I want you to be some of the first people to hear about this. And I think that this could be a really fun way to celebrate the center as well, with some art and you know, a bright spot coming out of this past year. So the mural project what is it? I've got some slides that I did not create, but I get to share. So you all know quite a bit about the Stabilization Center already, so I don't really need to go into that. But it looks like there are 5 different areas where there are some blank walls that could use some murals. So here are some sketches, just some rough sketches of possibilities, ideas, and you know, there's a lot of thought going into what kind of art would be appropriate for this kind of a facility. Both Jessica and Emily doing some research, as well as getting input from people who work at the facility. So Emily just kind of drew up some, you know, nice on the eyes, nice on the brain sort of images. So here we have a quote from Anne. So a little bit about the artists. So they are seeking artists. They have a pretty good idea of artists to reach out to that will have the specific skill set, and are also looking for emerging artists, and really want to prioritize marginalized artists as well. So $20,000 is how much needs to be raised for this project, and that will the large chunk of that is paying the artists themselves. And if you are so inclined to be a donor, you'll get a little bit of a recognition. But if you happen to know anybody that wants to give $5,000, they get extra special recognition. So and here is a list of the collaborators on this project. So I will stop my screen share here. So we'll be looking for donations. We'll start the fundraising phase of this very shortly. I also wanted to come here to invite anybody that is particularly excited about this project or was particularly excited about the center, to invite you to also send a quote, send a picture, maybe help out with some of that, some of the outreach to donors, to potential donors. And if nothing else, once you see the information coming up on social media, to share it and maybe say a little something about why this is an exciting project to you and why it means something to you. So yeah, hopefully we can reach that 20,000 very quickly and get to work on this project. So, Anne, I bet you have lots to add.
Thanks, Holly, and I'm so excited about this project. It's wonderful. When we showed the video of the new facility and part of it was still in process of being fully furnished, even still, it looked a little sparse in areas because given the population, we don't want to hang pictures on the wall, but we still want lovely things to look at. So this is just a perfect match in terms of having murals that won't hurt anybody, but will help everybody that's there. What would be really helpful to me, Holly, if you're willing, is it possible to share the PowerPoint that you just shared so that we could spread that far and wide?
Yes, absolutely. And there is also a website as well.
That would be wonderful.
I will put
Yeah,
that in the chat.
thanks so much.
So Holly, I would suggest that you send that to Jill Nixon. Jill will distribute it to us and it can go out to our own individual networks from there.
Great, thank you very much. And thank you for helping to spread the word about this. I think it's really exciting. Can't wait till it's done.
Thanks for taking that on and shepherding it this far.
Thanks, Holly.
Yeah.
Okay, any other questions for Holly or Ann about the mural project?
Do you have a sense of timeline, Holly?
I'm back. You know what, I don't. So I think a lot of it will depend on how quickly this fundraising happens. So the quicker that happens, it'll be just scheduling the artists. And of course, the getting the artists into the facility will need some scheduling as well to make sure that it's not conflicting with other things.
Holly and people from the Makeshift Art Space have worked really closely with both providers. So they know that there will be painting going on while residents and guests are receiving treatment at the facility, but found a way to make all that work. So very exciting.
Great. Thanks again, Holly.
Thanks for having me.
Next item on the agenda is the steering committee update. Barry, that would be you.
Yeah, thanks, Stephen. Good morning, everybody. We had our steering committee meeting. When was it? I think it was last week. Anyway, we discussed a couple of the big topics that are going to be on today's agenda, which are the annual report and the index committee updates. And as Jack announced earlier, Caleb won't be with us today to do that, but Jack and Stephen will lead us through a preliminary discussion on that topic. We also talked about the strategic plan and the need to keep that updated and clarity in our mission and our strategic objectives. We talked about communication strategy. We need to identify qualifications and scope of work for a communications expert to come in and help us. And we'll include that on an RFQ roster that'll be able to be built with different firms that have experience in this kind of work. We talked about the American Rescue Plan Act, or ARPA, and Tyler Schroeder, Deputy Executive Schroeder, is here this morning on our agenda under number 6 to give us a lot of details about what we know so far about that. We talked a little bit about the GARE, which is the Government Alliance on Race and Equity, about whether or not the task force should join that. There's a couple of workshops taking place. One took place last Friday, I believe, and there's another one coming up. And we could get some of that information out, maybe if anyone else wanted to attend that, to kind of learn what GARE is all about and how it could help our work. So I don't know if I missed anything, but I think that was the gist of our meeting. So Stephen, Jack, anything further?
No, I think that's good, Barry. Thank you very much. Any questions for Barry on the report? Very well.
All right, I think we're at annual report. Stephen, we're getting better at this. When we actually sit side by side, we won't know what to do. I mean,
I think the elbow bump will
like
work.
virtual dance, and we aren't texting back and forth either. So we're actually managing to make this work. All right. Well, I appreciate working with you, Stephen. All right. So the next topic is the annual report. And quickly, for purposes of history, from the inception of the task force and in the original ordinance, one of the stipulations or requirements from the county council is that there be an annual report, obviously annually. There's actually another reporting requirement as well, but this is the primary one. Most of you know that. I think it serves a couple of functions. One, of course, is simply to inform the county council of the work of the task force and things we want to communicate. But it has also become, I think, in many cases, a record of our work for the community. And it appears to me in reading it that many of you share that perspective, because it is a wonderful way for people who wonder what the task force does to go through and look at our annual reports and see the progress we've made, the goals we've tried to achieve, and what have been the priorities. So in that sense, I think it serves a function beyond just communicating to the county council. So thank you, everyone, for your work. We're at the point now, however, that I would, we'll need a motion in a moment to approve this. But I would hope, unless there's something in this report that really sets your hair on fire, we can always wordsmith it. We can always make it better. And we're kind of at the point where we need to be done with it for the most part. But that said, if there's something that really sets your hair on fire that's not okay in that report, we need to know that as well. But what I'm hoping is that we have a motion to approve any discussion that's necessary, and then we approve the report today, as we've announced for a while we need to do in order to meet our timelines. So with that, I'm looking for a motion from someone that's comfortable making it to approve the annual report for dissemination to the county council.
I'll make a motion to approve the annual report to the county council.
I will second.
Okay, are there questions, discussion, issues anyone has that they'd like to raise? Now would be the time to do that. Seeing none. Jill, so for the purposes of Zoom, can we do something like we did before with hands? If I orally describe what happened, or what do we need for a decision to be documented via Zoom?
We can either do a roll call, which I'm happy to do, or you can just ask for a voice vote, and anyone who wants to vote nay or abstain, they can do that as well. I have a record of everyone attending.
Okay, yeah, I don't think we need to do a roll call unless you do. It's probably quicker not to. So, all right. So what we'll do is we can do a voice vote if you want to unmute, and I'll give it extra time for abstentions and no's to make sure we capture any. So all in favor of the motion to approve the annual report for the county council, please say aye.
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 If anyone wishes to abstain, if you could either say so or wave your hands or do something to indicate that. I see no abstentions. If anyone is opposed to that motion, if you could indicate that through a voice, hand, or other way of noting on Zoom that you want to be noticed. Seeing none, I would say the motion passes unanimously. Does anybody have a correction to that? Okay, the motion passes unanimously. Thank you. Thank you, everyone, for all your hard work. I know this is a lot of work. Thank you. It's much improved by the effort of everybody participating. Back to you, Stephen.
Thanks, Jack, and thanks everyone for their contributions to the report. Mike.
Yeah, I just wanted to take a moment to cite some of the authors of the report, which is Jill Nixon, who's here today. Thank you, Jill, for all of your work on that. And also Mark Gardner from the city of Bellingham really helped out with the behavioral health component. So I just want to thank both of those folks and all the staff that put in a lot of work into this. It's an outstanding report, and thank you.
Thank you, Mike. I see lots of assents to the opinions you expressed. So we're going to move on the agenda, and I'll just say on behalf of Jack and I, this may be the shortest meeting I've ever seen from the task force. But as Jack indicated, the chair of the index committee, Lieutenant Caleb Erickson, is in the hospital and unable to be with us today. We had intended to have quite an extensive discussion about the needs of the index committee and our data gathering and data capabilities in general. Caleb has been engaging with the steering committee over a couple of meetings now over the status of the work in the index committee, what's been accomplished, what hasn't been accomplished, and we've essentially come out with a sense that we need to recalibrate what our expectations are of them and what our approach is to our data systems and how they underpin the work that the task force has done and intends to do as we move forward. With apologies to Caleb, I'm going to try to very briefly summarize some of the points he has made in these conversations. There's been good participation from the multiple stakeholders and agency perspectives that have been pulled together in the technical group for the index committee. Again, the technical group is really the IT level folks from law enforcement, the courts, and some other agencies. At the same time, there hasn't been a lot of sharing of information across those agencies. There are some significant gaps in the data that each agency is able to gather so far, and in particular, and of increasing concern as we move into the GARE world and our commitment to paying particular attention to racial equity considerations through the criminal legal system. We are limited in our ability to get racial and ethnic data that will allow us to track and be accountable of the reforms that we make. Quite a number of the stakeholders involved in the index committee and in our data systems are in the process of upgrading their data management systems. This is long overdue in most instances, and so a very welcome development, but they are being done independently. And so there is still no plan really for interoperability amongst those systems. Those systems are probably long-term implementation projects in the range of 1 to 3 years in some instances. And some of them, I know the small courts, small cities courts, and others are part of a bigger upgrade across systems, so they don't have a lot of flexibility in how they tweak those systems that they're shifting to. So that there are a lot of limitations, and at the outside end of those projects, we're also facing the fact that we really have yet to have any output from the index committee in terms of what data we do have. We can request it, but it's not at hand. It's not easily usable in our committees and in the task force as to guide our work. So there are a whole bunch of issues that have come up. And I think Caleb's view was that we're at a point where we ought to take a look at the structure of index, the charge to index, what our expectations are, and what our demands are really of what our data capabilities can provide us for this work. And at this point, given all those open-ended questions, the steering committee found that it was probably going to be most helpful simply to open up a fairly unhindered conversation amongst ourselves about our sense at this point of our data needs and what we would like to have coming out of the index committee in the relatively near future to provide it some new direction and perhaps greater specificity, perhaps a little more forceful charge that the agencies can take back to their leadership, and we can strengthen the effort that we've started and that Caleb is leading. Jack, do you want to add anything to that summary?
No, I think it was really good, Stephen. Yeah, we need a full dialogue, and our hope had been that the challenges for index would become obvious through a dialogue with Lieutenant Erickson and the different stakeholders here. Obviously, with his understandable inability to be here, it's a little bit like having a conversation about someone that, you know, and it's not really about him, but about index committee when he can't be here. So there's an inherent limit. The only thing I would say is I think it's good to have, as Barry mentioned, the first part of this discussion, but we need a dialogue with him too, I think, in order to achieve the goal of integrating index as effectively as possible into the goals of the task force.
Barry, is there anything you'd like to add before we sort of open this up a little bit?
No, I think you guys hit it right on the head. You know, we just need to have this dialogue, and it is important to have Lieutenant Erickson here, but I guess we can kick it off with some preliminary discussions and see where it goes.
Thank you. So if I could shape this just one last little bit, I think maybe what we're able to do today and would start to do would be to throw out some ideas, some areas that we think need particular emphasis, and any concerns you have about data that you see within your own agency or that you see in a partner agency that you'd like to be clearer or more complete. Efforts that you've found somewhat held back a little bit for lack of data. For one example in that regard, I'm hearing from almost every one of our committees that it's hard to be data-based, data-driven when we don't really have that information, especially in racial equity terms. So those would be the kinds of questions I hope we could touch on, and we can gather them, and then that can provide a structure, a skeleton for further conversation when we have Caleb back with us, hopefully next month. Raylene, you have your hand up.
Yes, thank you, Stephen. I just wanted to mention what we had talked about earlier, and we briefly mentioned in the last Legal and Justice meeting of or in the steering committee about possibly having Alexis Harris speak to the task force. She was able to pull data using different dynamics to do racial equity. She's a professor of sociology at the University of Washington. And I think there was other things that she would be able to touch on that would be beneficial to the entire task force on different areas of racial equity. But I think she might be able to assist Caleb and the rest of us on figuring out how to pull data that we weren't able to do with some of the techniques that they are using at the university.
Dr. Harris is one of the resources that has come up in conversation to enhance the work of the index committee. We've also touched on the possibility of having a consultant that might have technology tools that could be an overriding kind of connector between the different agency systems, since they don't connect directly themselves. Apparently, there are possibilities there that could be explored. So with those preliminary comments, I'll just open it up for any thoughts that this provokes in anyone's mind. Are there any? Mike, you unmuted.
I did. Thank you, Stephen. Well, thanks for bringing this topic up. And Stephen, you covered it briefly. So I just want to highlight a little bit about your comment and how key data is to understanding targeted areas for improvement. So vis-a-vis racial equity, that's one of the things, Opportunity Council had our own journey, just kind of looking at housing outcomes and then finding out that we might have different housing outcomes. So just to kind of say that there's that path can lead to some really key changes. But if we don't have that data, we don't know whether we're doing a good job or a bad job. And we've also heard from folks that really we think some people will assert that we may have less issues here than some communities do regarding racial equity or disparate impact. Until we have that data, we really aren't able to know that. And so I just want to thank you for your comment, Stephen, about how key that is. And so it's so great to work with folks, including Caleb, including the index committee, including everybody on this committee who values data and truth. So I think as long as we keep our foot to the pedal on that, then that feels like we're doing justice to wanting to apply a racial equity toolkit and to employ those practices. So thanks again.
Thanks, Mike. Arlene, I see you're unmuted. Are you preparing a comment or? No. I'll give one example that struck me recently of this. As you know, there have been calls from the community over the last year for development of an unarmed response to crisis calls. And to Ann's credit, the health department and other partners have put a huge amount of work into exploring that and trying to develop that capability. And just recently, Ann reported that the data shows a much lower portion of what are initially identified as behavioral health calls and then end up actually being behavioral health calls. And I think the data that she reported on that question is really not at all what I would have expected. And without that data, we could be working in a direction that might not be productive, might not be effective. So the role that kind of data and the care taken to assemble it and think through it, I think is a really good example of the value that this has, even outside the racial equity area. So I don't want it to be thought that racial equity is the only place that our data is lacking and could be helpful. But I do want to emphasize that having adopted the racial equity toolkit, data is at the core of every question that we ask through that lens. And so at this point, we're really shorthanded in that respect. I'm sorry, Moonwater, I didn't see your hand there for a while.
That's okay. I think I'm looking forward to when we have an even more robust conversation. But I think one of the more general comments that's coming to mind for me is just an acknowledgement that the data collection, I think, has been a struggle for this entity to work with and to pull from, and that was the impetus behind the formation of the Index Committee. And we're many years into this task force, and we've implemented some new programs. And so one of the questions that comes up for me, or sort of a challenge that I think we should hold ourselves to, if possible, is to be able to look retroactively at the good work that has come from the different groups and system changes that have emerged from this, from this collective work, to be able to see whether or not any of the newer programs that have been implemented over the last few years since the inception of this committee have actually had an impact on some of the things that we've said that we care so much about, of the disproportionate impact of incarceration and touching the system, that can occur. And so I think I'm sitting with the recognition that as time passes, good work is being done. And how can we help ourselves evaluate the good work that's been done through the lenses that we value so much? And so I'm just naming that. I hope that we can identify some clear data points that cross the different lenses and focus areas of this committee, and use them to measure our future success. But I'm hoping somehow we'll also be able to use them to measure some of the change that's happened over the last few years since our inception.
Thanks, Glenn. Other thoughts?
Oh, Heather, go ahead. I'll go after you.
Thanks, Jack. Heather Flaherty, for the record, citizen representative. I'm just curious about, it sounds like the question at hand is, what is the purpose of the Index Committee for the next few years? It sounds like there's work to implement data systems that would be able to collect and provide robust, hopefully robust information. Is that right? Did I get the question right?
The question is really, what are we hoping for from the Index Committee at this point? How is that perhaps any different from what we asked of them at their outset? What concerns are we having about data? How can we make our data focus more efficient, more comprehensive?
Got it. So I am echoing at what everybody's already said, and just for the record, I think it's so important. I really agree with what Mike Parker is saying about how do we know, and Moonwater, you're saying this too, how do we know how we're doing if we don't have measuring of how things have been and what the improvements are. And I also just think about, like, our task here is incarceration reduction and prevention. So what are the data points that are really important for knowing, are we reducing incarceration and are we preventing incarceration? And in lieu of, I know data systems can be very expensive to implement and take a long time. But I think it would be awesome if the Index Committee could think about, okay, well, what's the beta version, or what's the DIY version that we can do? Is there a pilot that we can set up? Is there an intern we can hire who can just come and check a box for us and interview for 3 months, who's in our jail and what's their race? And if the FBI doesn't ask if somebody's Hispanic or Latinx, let's add the box manually and have somebody do a pilot and just give us a snapshot. So that would be one thing, is what are the creative solutions? And the second thing is that I think we do have a lot of data available to us through the health department that's already being measured. And it would be really interesting to know, what are the proxy measures that we could be looking at that would be important for us to track here. And particularly on the prevention side, I know that we survey this school children a lot on behavioral health. So where is that being tracked? I know it's being tracked. I know it's a priority of the health department, but I think that would be important for some of our work here too. So what is already being measured? And the big dream, this will be the last thing I'm going to say, is like, I would love it if we could have a community dashboard online that actually shows us, here's the recidivism rate this year, here's who is coming back to jail. And especially with that Blake decision, I think that the treatment side is going to be so important, because we won't have that incentive for people to be going, to hold them through a drug court or to hold a record over their head for accountability. So that would be the dream, is to have some sort of big dashboard to say, here's how we're doing. And yeah, I'll stop there. Thank you.
Great thoughts to that, Heather. Thank you very much. Arlene.
I serve on the North Sound Behavioral Health Advisory Board, and they are keeping very detailed records of crisis calls, the numbers of crisis calls. But to interpret the meaning of those numbers is another task. And I think to some extent we're wanting to not just count things, but to understand the meaning of the changes. An example would be a great increase this past year for crisis calls during this pandemic. But that's what I'm hearing from some of you, is that there is information, there is data, but it's in pieces all over the place, and there's no central organizing of the information that we do have available, so that like it's similar to the services that we need to know about, we discover them instead of knowing what they are. So the idea of a dashboard would be really a terribly good idea.
Thank you, Arlene. And I think the North Sound ASO data resource is really important to acknowledge. Jack, I'm sorry, your hand's been up for a while.
No, that's fine. My hand's up a lot. Just a couple quick thoughts, particularly for those people who haven't sat from the beginning. I know Ann Moonwater, Stephen, and I all heard Ken Mann constantly repeating, who's in the jail? And my memory was, in part, Index came about from, at that time, a challenge in answering that question. And my memory is we were told that the computer systems, one was Spillman and there were others, didn't lend themselves necessarily to some of the information we wanted. When we look at things like the Crisis Stabilization Center, there are HIPAA considerations. Courts use different systems. Some people are on paper, and the list goes on. And in talking to Lieutenant Erickson, I think it's fair to characterize, he sort of said, look, with Spillman, we figured it out. We kind of got that information out, but now there's other barriers, probably because of cost and prioritization, to getting data that might be useful. And data costs money. I mean, in other words, to get the information that would help this task force and help policymakers make decisions requires the use of resources, human and financial. And I think what he's looking for, to some extent, is some guidance from us as to what we would find useful. And then he has to figure out if it can be cost effective or is affordable, or go to the people that would make those decisions, or some of the people might be on this task force that would make those decisions. And there will always be a legitimate desire for more effective data than our systems have the capability of producing it. And this is clear in the Vera report. It's clear this is a nationwide issue that virtually all criminal justice systems wrestle with because of the disparate parts. So I think part of his hope in the conversation is to say, look, I've come this far, and to go further, I need to understand not just what you want, but also who's going to participate in obtaining it. And I think ultimately we're going to have a balance between what's easy to get, and certain things on a dashboard, if they're easy to get, are great. So we have to balance what's easy to get with what we really need to have. and find, as we often do in all systems, government, families, all sorts of systems, what's our cost benefit and can we afford it? It doesn't make sense relative to our other opportunities to put resources elsewhere. And I think the hope of the conversation in part was to raise everybody's consciousness or awareness on that issue, and figure out what's really important, what we can do, set realistic expectations. And obviously, if there's low-hanging fruit, grab it. So those are some of my experiences with Index as I've watched it emerge and watched Tyler wrestle with it, our first Index chair, and it's yeah, it's not this is not an easy circumstance, and often we find we need the data when we needed it yesterday. We often find we're clamoring for data because we need it now when we hadn't thought about gathering it previously. So thanks.
Thank you, Jack. And I think you added some nuance there to some of Caleb's communications. Mike, your hand is up. Floor is yours.
Okay,
Yeah,
great.
thank you.
Yeah.
Mike Hilly first, then Mike
Mike
Parker.
Hilly, please.
It's a good name, Mike. Hey, thanks. I wanted to let the group know that, we've done a little bit of this work out of our office. Jeremy Morden is the data analyst that's been building some interface between the jail data, law enforcement data, and our platform called Gelada, which is being used by the community paramedic group and Grace group. And so we know that while it probably can't serve as a community information exchange in a big way, that data is being pushed towards it, of course, with the interest of what our groups are. But I think Jeremy would mention some of the gaps or what Jack just talked about, which is moving to the future, because it is an extraordinary amount of work. And once those interfaces are made, which we're about 95% done with those interfaces for Gelada right now, then who's looking at that data, what type of presentation, and once again, dashboards, which are a great idea, still cost a good bit of money and somebody to continually be moving that data forward. So, but I do want to let the group that we do have a good amount of work going. And Jeremy's been working with Lieutenant Erickson since January to do that. And I know Lieutenant Erickson is also looking at a sort of a parallel platform to push that work out too. So I just wanted to update the group on that.
Thank you, Mike. That's tremendously encouraging. Mike Parker and then Arlene.
So just very briefly, as I listen to both Moonwater and Heather Flaherty talk, it struck me that this data is also a storytelling device. And I just remember, Barry, from the report out from steering and how we value that. We really feel like we owe that in many ways to the community at large. And data will not only help us find trouble spots or exonerate us from that, but it helps us tell the story of what's happening in our system. It helps tell that story and the experiences. And it will help us monitor. So I see that as another need. So Jack, as we think about those needs or what purposes might we want that data for, part of it would be so that these professionals that we hire through an RFQ can have the right things to put together to tell the story about the work of incarceration reduction. What does that actually look like on the ground? So just yet another plug, but kind of from a different angle about why data could be so useful. Thanks.
Thanks for adding that perspective, Mike. Arlene?
I wanted to ask Mike if you're saying that we have a problem with people and information staying in separate silos.
Oh, was that for me, Arlene?
Yes.
Yeah, it is a little bit. I think for the Gelada system, a little bit of the design is to be sort of a community information exchange or health information exchange. But I think one of the problems that we run into is the technical aspects of these systems being different and trying to get them to hook up and connect. So my understanding, that's a little bit of the difficulty from Lieutenant Erickson's point of view, is these older systems, a lot of data that was in those old systems and now be brought into newer systems. But yeah, I think that a little bit of a gap there. We probably should have something that the entire community could share and get into that would work for everybody to pull those specific pieces of information that is relative to their work into that. So it's access, and how do you get people all access into that one system?
Yeah, I see your point. It's sort of what I was saying before about the information is in pieces and in different organizations. And so we don't know about it or hear about it, except like, just now you gave your report. But where would I hear that? Where would I see that?
And to your point, obviously this is EMS interest stuff in our community medics and GRACE program and information to bring in with those specific patients. But once that data is really big time in there, what does it mean to other groups? What does it mean to human services, health department, opioid prevention, et cetera? So I definitely agree.
I would just like to add 3 quick things. One, Jack, I really appreciate your context about the expense of data. And I was looking at our county's budget last week, and we spend a lot of money on our criminal and legal justice system. And I would say it's about half of our budget, right, that goes to that. And so I think about the cost benefit analysis of investing in a data system that could then help us be more efficient with those dollars and create the better, more targeted strategies. 2, for Mike Hilly, I appreciate your report too on the work your department's doing. And it made me think about like all of the people working in the system, and you especially, Ann Deacon, you're making data-driven decisions all the time and creating really important projects and safety net pieces of the system and diversion pieces. And it would be really interesting maybe for the index committee, if you haven't already done it, or for the whole task force, or maybe there's a special data meeting for those of us who are really interested to know what are you tracking and looking at already. And if there's a way that we can start to build to that de-siloing and kind of collective data, because you're making data informed decisions already. I believe that. And the third thing is I just sent to Jill Nixon and Stephen Gockley. Jack, your email didn't come up easily, otherwise I would have included you, but Oregon has an example of a criminal justice dashboard that if the committee is interested in looking at, it goes through things like recidivism and equity and can show you recidivisms in arrest, conviction, incarcerations, show you by race and gender. It'd be interesting to, if the index committee hasn't already connected with them, it'd be great to know how did that develop, and could we borrow some practices from there.
Thank you, Heather. Enormously valuable. Other thoughts, other comments? Well, Jack,
Heather, if I do your Gmail, will you get that? The Heather, is that the best one? Okay, got it. All right. We'll take the rest offline.
Jack, I think we've, oh, I'm sorry, Moonwater.
To Heather's earlier suggestion around a DYI option as well in the meantime. And I know this conversation started with the comment about connecting with the University of Washington. I'll share that our statewide association had great success partnering with the University of Washington to have a group of graduate students help Resolution Washington statewide think about data and data collection. We're 21 different agencies. We track, some similar, some different information, and they actually built a data tool for us, did an incredible amount of research, and then have continued to work with us many, many months later. So there are incredible resources out there that we could tap into to help jumpstart sort of further creativity as well. So I'll just offer that up, and I'd be happy to connect our association with anyone who would like to learn more about specifically the graduate program that we worked with there.
Thanks, Moonwater. Jack, I'm going to suggest that we've accomplished phase 1 of this discussion, and I think we have a list of perspectives and topics and suggestions that we can forward to Caleb and get his response to, and perhaps move forward with this conversation in the next phase at the July meeting. Any other thoughts? Okay. Jack, you want to take the next? Let's see.
It's sure I can. I'll just be introducing Tyler, I think. On he's everybody's favorite person now because he's coming, bringing the possibility of money. Or did he disappear? I said that.
Oh no, I'm here, Jack.
Oh, there you are. All right. Okay. I couldn't see on my screen.
Hi, Task Force. Tyler Schroeder, Deputy Executive. I think I've been asked to come back and give a little report on the latest and greatest on the American Rescue Plan Act dollars. I gave a little brief outline to the task force at the last meeting, but at that time there wasn't as much guidance to the county and the cities on the availability and use of the dollars. In the packet today on page 39 through about 45, I think, is a memo that the executive outlined to the county council on the dollars and the availability of them and the use. And then also a recognition of kind of the process that the county is looking to move forward with. So as we've talked, the county has $44 million in local and state fiscal recovery funds for utilization. My understanding, the city of Bellingham has about 21 million, and the small cities, I would say, have about 5 to 6 million in total. I want to kind of recognize that those are just the dollars that for the state and local fiscal recovery funds, but there are a number of different programs through American Rescue that we should be looking into and considering for very similar topics that relate to the Incarceration Prevention Reduction Task Force, and really just overall projects in our community to bring us kind of into a new normal and a better normal than maybe we started into the pandemic. So that's something to keep in mind. These dollars are really for the response efforts. You can replace some revenue from county jurisdictions, provide some economic stabilization, and then address systemic public health and economic challenges. So the memo I included in the packet really walks through it. I did want to call to attention maybe a request of the task force. You know, in the past, there was some question about how best to provide input into the process and how committees could or the task force could connect in. What the county is taking is some immediate action for lost revenues and for workforce support for the county. And we'll be moving forward with some frozen positions and opening those up to help us kind of come into the summer to be able to reopen our doors, or at least have all of our doors open, because the court system and the sheriff's office and the prosecuting attorney and public defenders, we've all been working throughout the pandemic, but there are some departments that have had their doors shut that will be opening them up. And so that's kind of the first step, and we'll be taking that step through the summer, working with council to open those up. And then really the difference between the American Rescue dollars and the CARES Act dollars is the time frame. So the American Rescue dollars can be spent through or obligated or spent through 2024. But then also if it's a project or a capital project, can have to be spent by the end of 2026. So to be able to have some community dialogue, input from task force, and bring it forward, the recommendation to the council that they're amenable with or agree with was to work through the fall on actual kind of programmatic, thoughtful decisions about how these American Rescue dollars can be used. So we will be engaging the county council on budget actions for 2022, and then also into what we call in the county the biennium budget process, which would be for the 23-24 biennium as we move forward. So the request to the task force would be to maybe send along some documents that we have, some resources on where the American Rescue dollars can be spent, and send that to the committees. have your committees take a look at their program and their priorities, and then see how it fits with American Rescue to see where we can go with them. It's important to recognize that these are one-time monies. They are for 3 years, so there can be some kind of consistent programming of them. But a lot of the effort will be looking at one-time expenditures, whether that be a capital facility, infrastructure associated with it. But you could look at some programmatic support, starting programs or enhancing programs. It just is really important to recognize that at the end of 2024, the county would have to find the funds to continue those programs. So it's just a recognition of that and importance to it. There are some criteria to the use of the dollars that is laid out in the report, as well as in the FAQs and the documents. Two, I kind of wanted to raise to the attention. One, there's a lot of language about addressing behavioral health care needs that have been exacerbated by the pandemic. And that, of course, would include mental health and substance abuse, which this committee is this task force is very aware of and has really focused on it as it relates to the Crisis Stabilization Center. Included in that also is crisis intervention work. So I know that there's been discussion and maybe some proposals to enhance our crisis intervention systems. And that would be something that probably the Behavioral Health Subcommittee should take a look at, or at least kind of acknowledge and understand. And then the other one would be kind of real consistent with the conversation that the task force just had on data systems. So one of the language is to enhance public health data systems and see how to move those forward. So I know that we've had a lot of conversation about criminal justice data systems, but I also believe that at the end of the day, a lot of it is a public health need. And we could look at how to expand our public health data systems to incorporate some of that criminal justice work, as well as some of the racial equity and inclusion discussion that you guys were having earlier. So those were two I just kind of wanted to point out to the task force. And if there's any questions, just to let me know. And I'll kind of transfer back to Jack and Stephen at this point.
Thank you, Tyler. Are there, Heather, I see your hand up, and other questions, please, other questioners, please line up.
Tyler, forgive me if you already covered this, and just kind of glancing at the memo, it looks like there's 2 phases that the county's thinking about. Can you tell us more about what that looks like, what that means, and what the county's thinking is on how you want to gather public input, if there will be like a formal table set or facilitation of that, or if this is part of that going to all of these different committees you already have?
Yeah, no, good question. So we did kind of recognize a phase 1 and phase 2, but really it was to recognize some county support that was needed, some decisions that we could easily make to move forward the county workforce. And that'll be happening in June, July, and probably August. There's 21 frozen positions that we froze for austerity measures. Going into the pandemic, we're going to open those up. There's the local government revenue that we can reimburse. We're going to accomplish that as soon as possible. And then there are some other actual county operations that have been impacted. And I see Amaya's here. So the criminal justice system has a very big backlog as it relates to court cases because of the pandemic. So we're working with the courts and the public defender and prosecuting attorney on how to maybe add some additional staff for that purpose. So we envision that kind of just as a standard county budgeting process and things that we need to react to quickly. And then the second phase would be this community outreach, community program development. And that's, as I kind of indicated, we will be working, and we haven't fully defined what that looks like, but we will be working to engage task force, to engage the community on priorities that the dollars could be used for. And then talking with county council on how they would want to budget that moving into 2022. So there are some things that we want to kind of be thoughtful about and get that community input. One opportunity that we've talked about is providing kind of a survey format, recognizing how the funds could be used and trying to get some priorities from community members and organizations where they would want to focus those dollars. And then also, I think, as Jack likes to say it, I'll probably be on the circuit going around the task force, kind of having questions and getting input from task force and letting them know how to engage into that process. So that's kind of that's our initial framework of how we're going to be moving forward.
Great. That's really helpful. I'm curious too, at the end of the day, who and how are the decisions made? Is that Executive Sadhu recommending to council for approval?
Yeah, it's a standard kind of budgeting process. And so it'll be just that, to that effect. Hearing input, getting an understanding of needs, recommending budget supplementals to budget to the county council, engaging the 7 council members on where they're at, and then they would have the final decision of the $44 million of American Rescue Act.
Excellent.
Yeah.
Thank you.
Thanks for that added depth, Tyler. Are there other questions? Okay.
I think we're good. I think we're at other business, which I'm not aware of any. All right, you want to do public comments, Stephen?
Sure. Jill, if there are any members of the public attending who might want to make comments, would you invite those, please?
Yes, thank you. We have a number of attendees at the meeting today. If any of you would like to speak to the task force, please virtually raise your hand now by pressing the raise hand icon on your screen or by pressing *9 if you're dialed in by phone. No hands are raised at this time.
I do see that Mark Gardner's there, and thank you, Mike, for calling out Mark and Jill and others who did the annual report. But Mark, assuming you can hear us, thank you for your effort this time and your effort on the previous reports. And as Mike so eloquently stated, thank you, Jill, as well. We obviously couldn't have done this without you, and it's a lot of work. And thank you for all your effort on that. Anything else, Stephen, to add before we adjourn?
No, I don't think so, Jack.
All right. Well, thank you everyone for being here. It's 10:15 and or 10:13 and we stand adjourned.